Hello, friends. Thank you for tuning into Intentional Living with Emla podcast again. And I hope you're having a wonderful week so far. Today, I am so excited to have over on our podcast today, Dr. Mara Sheehan. And tell me, Sheehan, I've never seen that name before. What's the origin of your name?
So it's my husband's name.
Yes.
But interestingly,
Uh-huh.
my husband's father
Uh-huh.
was actually adopted by Mr. Sheehan. So
Okay.
it's not, so it's like an Irish name, but I'm not Irish.
Yes.
So
Irish name, but you are from Austria.
I'm from Austria. Yep.
I cannot hold it. Before I even introduce you. So tell me about the Sound of Music.
Oh, the Sound of Music. I actually never saw the Sound of Music until I moved to the States. It's not a thing in Austria. It is not a thing.
Really?
No, not at all.
Okay.
It's a lovely movie. It's a beautiful movie. My kids love it. We used to watch it. But if you go to Austria as an Austrian, if you ask people around, they were like, what? I've never seen this movie in my life.
Oh my goodness, that is so funny. So, but for me, when I hear Austria, I'm like, oh my gosh, first thing that comes to my mind is Sound of Music.
No,
yes.
Yep.
But I am so honored to have Dr. Mara today. And she is a physician trained in internal medicine. Mm-hmm. So tell us, what is internal medicine for the person who's listening and just know, we know doctors, we see a doctor. Mm-hmm. What does internal medicine mean?
So internal medicine is pretty much general medicine. It is, we treat everything in the adult. So we do not treat kids or pregnant women, but it's pretty much everything. It's diabetes, hypertension, pneumonia, colds, anything that falls under internal medicine. Okay. Once it gets a little bit complicated where we need a cardiologist or a pulmonologist, that's where the consults come in. But typically it's like general medicine.
Okay,
and
perfect.
I work in a hospital, so I'm a hospitalist. So that means I'm, if you think of like a house remodel, for example, I'm the patient's project manager. So I make sure that they are taken care of from the beginning of their stay to the end of the stay in the hospital. And I'll make sure that everyone's on the same page, that everyone communicates with each other. And that's kind of what we do as a general hospitalist in internal medicine.
Perfect. So Dr. Mara is an internal medicine doctor and she's a hospitalist. So when you hear the word hospitalist, you know, she works in a hospital taking care of your stay from the beginning to the end. But there's something unique about you as well. You also work in a concierge care model here in Central Ohio. Mm-hmm. So tell us about that. So
me and my partner, Dr. Patel, we've been working in the hospital for, many years. And we saw a need that our patients have, that they don't have primary care physicians. They either can't get in, or they will see their primary care, their nurse practitioner, or it's like a 6 months wait. Yes. So, and we always wanted to create something that we really, really can take care of patients. But we do not want to do anything with insurance, because insurance, unfortunately, sometimes drives the care of the patients. 100%. So we were like, let's try this concierge medicine practice. So that's what we've been doing since probably close to 3 years now. I love that, because we know you're talking about that and my mind just went back. There was a time when I missed my annual wellness visit. And because my daughter was not well, so I had to reschedule that visit. When I called to reschedule, they didn't have another opportunity for me to see my primary care physician for another 7 months. Yeah. And that's unfortunately 7. It was going to take me 7 months. Yeah. For an annual wellness visit. It's unfortunate. It's the way medicine is at this point. It's unfortunate. And you probably love your PCP. I love my PCP, but I just couldn't. I'm like, so you really mean? And the lady on the phone was so nice, the reception. And she was like, so nice. She was like, oh, I'm so sorry, Emla. The next available appointment for an annual wellness visit is 7 months from today. It's crazy. I'm like, this is not right. Yeah. We don't prioritize preventive medicine, because the annual wellness visit is preventive medicine. Yep. We want to keep people healthy. Yep. But if I were to get ill today, I'd be sent tomorrow. Right. Yeah. So we wait. We just like treatment, and we need to proactively take care of that. So you bring your clinical experience, and I just love your global. When did you move to the U.S.? 2002. 2002. Yeah.
So you've practiced, I always love when I meet somebody who has lived and worked or studied in more than one country. They
Yeah.
always have a different perspective, a broader and a global perspective to life. And I love that you bring that to medicine, and you bring that to, in addition to your work at a hospital and your concierge medicine, you are a parent, you are a wife, you are a mother. And tell me how being an amazing parent has helped you be an amazing doctor that you are in both ways. How does that
I'm
help?
not sure
How
if
does
I'm
that
amazing.
Well, I don't think. Well, I'm not asking your
But-
children to describe you. So so the children describe us differently. But yeah,
So how it helps me, I mean, I honestly, I feel like I have a great support. My husband's a great
yes,
support.
lovely.
He's been great when the kids were little. I don't know how the hell I did this. Excuse me, I just said the hell.
Yes, you're fine.
How I did this when the kids were little in
Mm-hmm.
training and with residency and working nights, and I had 3 little kids at home. He was super supportive.
Yes.
So, and I also, I guess it comes to the point and also intentional living,
Yes.
because I do take time for myself because I know I need to rest, or I need,
Yes.
I'm not gonna do, this dinner, or I'm not going to this conference because I just need to take care of myself in order to be a better mom or a better physician, or just my mind sometimes needs rest. So, and
I
I've
love
learned
that.
this more and
Yes.
more the older I get.
Yes.
At the beginning you're just trying to run around like crazy, but then you're like, why? Wait, this is not working.
Take a
So,
deep breath.
yeah.
Yeah. Take one step
Yeah.
back. And I love, it was wonderful seeing you at the Intentional Living brunch.
Yeah, that was awesome.
And thank you. Thanks for taking time out of your busy schedule to come hang out with us. And I just, felt like our listeners will be able to benefit from you. I just looking at it from your diverse practice. You practice in a hospital, you practice in concierge care. Among the pillars of intentional living, which are nutrition, movement, inner alignment, and positive social connections, if you were to say there is one that you feel like your patients will benefit the most from, if they were to make an adjustment with it, which one would you pick?
Oh my gosh, that's I think the social connections is
Social
very,
connections.
very important.
She picked the social connections. There's an 85-year-long study out of University of Harvard that was doing longevity and belonging. And they said the most important marker for a patient's life and health as they age is the quality of their relationships.
And I see this with my mom. My mom's 80, she'll be 87 this year.
Uh-huh.
She has a more active social calendar than I have. And she is busy and she's healthy. I mean, she has
Love it.
but and that keeps her. I could never see her without that. And it's so interesting. I see friends and families, their loved ones, they, once their partner dies and they just don't want to, they
Do anything.
they don't want to do anything. And it really, I really believe that social connections helped. And I'm just giving my mom as an example, helped her
Yes.
to just stay stronger since my dad passed away like 16 years ago.
Yeah, in our traditional healthcare model, we have not prioritized that.
No,
We've not
at all.
prioritized that. So I it's something that I ask my patients all the time when they come in, and I say, what brings you joy? Like, who are the people that you spend time with? That's something that the average person goes to their physician or their primary care. They're not questioned about positive social connections because we've not had it in our metrics as a measure of health.
Correct.
And it's just hard to measure that. You can't put a scientific number on that accurately. And we're so keen on the numbers. It's important. The numbers are important, but positive social connections is just one of those pillars which I feel strongly affiliated to. I want to see your patient dynamics. So the patients that you serve in the hospital versus the patients that you serve in the concierge. What is the main difference in this patient population?
As the age and how healthy they are.
Tell me more.
So inpatients, unfortunately, they're mostly sick, chronic illnesses, lots of chronic illnesses, a lot of social issues.
Yeah.
I would say we run into so many, how do we get them home safely? Who's going to take care of these patients at home? You got to call, the family, the husbands, the wives, the kids, and it's crazy what you see sometimes versus the outpatient. I feel like most of our patients are younger and they want to stay healthy.
Yes.
and they want to invest their
In their
money
health.
and their time into our practice to stay healthy, because we also we focus on, we want our patients to stay healthy. We want
Yes.
them to
Yes.
have all the preventative things that they need to. But I think that is the difference between inpatient and outpatient is definitely the age and the chronic health issues.
You mentioned chronic health. So if you were just looking at our healthcare landscape in the US right now, if there was one intervention you would recommend for the patients that want to stay healthy, for one thing that they can change in their lives to be able to continue to stay healthy, what would that recommendation be to prevent chronic disease?
One thing.
No, you could give me 3.
Yeah.
You could give. She said just one thing. Let's go. Yes, give me 3. Yes.
So I think first of all is nutrition. I
love that.
Me
Yes.
coming from Europe, I do have an issue with
Please tell
with
me.
the nutrition here.
Do tell.
That the portion sizes are humongous. It's just, why do you have to have chips with every meal? I just never we don't grow up with this.
She said, why do you have to have chips with every meal?
Yeah.
And somebody who was born in America and raised and is like, why don't you have to have chips with every meal? That's what we do.
Yeah.
That's how we've always done it. And that's how we ended up with all these chronic diseases.
So definitely the nutrition. I do feel like here in the States compared to Europe, I feel like the movement and, people exercise a lot and there's a lot of, people go to the gym and things like that. But another thing is sleep. I think sleep is an issue that gets so neglected. I'm a big fan of good sleep. Sleep is always the best medicine. And then I would also say just maybe just staying on top of things and not take your own responsibility for your health,
I love that. So you heard Dr. Mara. She said the first thing will be nutrition. And the second thing, what was the second thing you said?
Sleep.
The first thing is nutrition. The second thing is sleep. And then the third thing that she said, that caught my mind. Take responsibility for your health.
Yeah.
Take responsibility for your health. So people, we would take a vacation, we would spend money on, and all those things, but when it comes to investing money in our health, we're a little hesitant and we wait until something happens and then we run to the hospital.
And then sometimes it's too late.
Sometimes it's too late.
Yeah.
Sometimes it's too late. So what would you say, so concierge medicine is becoming more and more common, and we're beginning to see a lot more concierge practices today than we saw 10 years ago. So what are the advantages? And tell me advantages and disadvantages of a concierge medicine.
So an advantage of the concierge medicine is that we take when I schedule a patient, we take a lot of time.
Yes.
It's not
which is needed.
I don't have like only 25 minutes.
Yes.
I pretty much, I have an hour and a half. I don't have a waiting room full of patients waiting for me.
Yes.
So we try to get to know our patients really well. We try to make sure that we have everything that they need, like mammogram, colonoscopies, a cardiovascular screening, whatever they need in their stage of life. The advantage is that we are, as a concierge medicine, you are smaller than a typical practice.
Yes.
My practice, we communicate through an app. So we are very easily accessible. So I don't know if it ever happens to me. My PCB is great. So she always messages me back when I need to. But I don't know. Sometimes it takes more than 2 days to get an answer back, or sometimes you just really need to know something right away. Do I need to go to the hospital, or do I need to go to an urgent care? So we do have an app, and we try to answer as soon as we can. I think one of the disadvantages is the cost. Obviously, a lot of people that they have insurance. Some of them say, "Why would I pay for you if I have insurance?"
Yes,
right? But we don't have a copay, for example. We don't. What you paid monthly is what you get. You can see us as many times as you want without an additional cost. But I think the disadvantage for most people is right now just the cost. But I always tell them, think of it as a gym membership or
investment
a prescription
in your health.
a subscription to Netflix or Hulu or whatever.
Yes.
So I think and it's something that you should have. We try to get our patients in at least twice a year to get a regular check. So I think you just have to do invest in that, so you get you stay on top with your medicine, with your medical needs.
This podcast is sponsored by Journeys. your path to intentional wellness. Are you feeling fatigue, brain fog, low energy levels, and suspicion of inflammation? Most health problems don't start overnight, and neither does wellness. With Journeys, you can take charge of your health before you have to. Every cell in your body is whispering to you. But when we ignore preventive medicine, we wait until those cells are screaming. Journeys helps you listen to the whispers. There are 3 different lab test bundles to choose from. Starting at $199 up to $479, we measure up to 125 biomarkers, most that are typically not measured at your annual wellness visit. Normal labs is not a diagnosis. We get the most complete view, including hormones, nutrient markers that support energy, balance, and healthy aging. Each journey includes a personalized recommendation, one-on-one care from your pharmacist, and follow-up support to turn results into lasting intentional change. It's more than data. It's guidance, accountability, and a partner in your wellness journey. Intentional living means paying attention, staying curious, and taking steps towards the health you deserve. Start your journeys today. Click the link in the show notes. And I was on your website the other day, and I love the fact that you are very passionate about preventing, about not waiting. You do all the biometric screening, and you do the calcium material score. Like you do all the things to keep us healthy and prevent that chronic, especially cardiovascular disease.
Yeah, it's the number 1 killer for women. Yeah.
Tell me about that. Dr. Mara just said cardiovascular disease is the number 1 killer for women. That statistic should scare any woman.
Yes.
And we should be proactive about that. One of the third thing you said there was take control of your health.
Yeah.
So take control of your health. I'm going to share a link in the show notes with how to schedule an appointment with you or how to become one of your patients at your practice. And just so that you can be able to take the time, it will be nice to sit with a doctor for about an hour.
Yeah.
And just get a deep dive into my health in all the aspects.
Without feeling rushed.
Yes. Yes. And they can answer all the questions, and then you give them the keys. You know what? I usually say, do not put the keys to your health in somebody else's pocket.
Yeah.
So I love that you empower people. You want people to take control of their health. We've had this issue where a lot of people do not question doctors. A lot of people come in and they're like, oh, I'm like, why are you taking this? Or why do you do this? Oh, the doctor said I should do it. Did you ask why? Do you understand? And typically, it's not because the doctors have bad faith. It's just because the doctor doesn't have time to explain all that stuff in a 25-minute or 20 or 15-minute visit.
Right.
But you're able to do that with your patients.
Yeah. I always tell my patients, even in the hospital, that you need to ask your physician, why are you on this medication? Oh, I don't know. It's like, go ask. It doesn't hurt to ask. They need to tell you.
Yes. So it's really important. She said it doesn't hurt to ask. And the physician is trained, highly trained, high clinical aptitude. They know it and they have experience and they can explain it to you.
Yeah.
And I have a lot of physician friends. And the reason why I do that is because I learn from them every time. Every time I sit down with a physician, I talk with them, I learn something, and I ask, just always ask questions. So people, if you're listening today, Dr. Mara is empowering you to ask your physician all the questions because they went to school so that they can help you. And so don't be afraid to ask those questions. Yeah. Don't be afraid to ask those questions. The other thing that I want to ask you is about the fact that people, there's a lot of specialties right now. And every physician feels drawn or attached to one particular aspect of health. Is there a specific part of health that you feel personally drawn to?
Yes, perimenopause and menopause.
Tell me more.
I tell you why. A couple years ago, I personally was in the boat where, like, I don't know what's wrong with me. I had all these symptoms, and I felt left alone. And I did my own research, and I got to, I'm a member of the Menopause Society. I did a lot of own training. We never got trained in this.
At school, in medical school.
Or in residency. I actually don't remember ever talking about menopause. I think it's really fascinating how rewardful this treatment of perimenopause and menopause is. I have patients that come back and say, you saved my marriage. Because, and it is, you don't see this in the inpatient side. In my hospital, unfortunately, most of the times it doesn't end too well.
Yes.
So I'm experiencing
it's personally
this
fulfilling
this
for
is
you.
a nice feeling, actually. I like this. And it's fascinating. There's so much to learn. I mean, I just signed up for another class. And I'm not an OB or whatever, but there's so much to learn about it, and I just love doing it. So I'm really passionate about that.
So I sense that you're partially doing it for your own personal fulfillment reasons, because you feel so good when a patient comes back and says, "You saved my life. You saved my marriage. I'm so grateful for how you took care of me last time."
Yeah.
That must feel great, because
does,
yes.
Because as a physician, you don't really get that.
You don't get that often. And you don't get that in the hospital.
Not in the hospital as much.
Yes.
Yeah.
So I can see how you're doing that for your own self. And then we as your patients are benefiting, as your patients are benefiting. That is lovely. And the fact that you have gone out of your way to seek additional training to be competent in this, to be able to do it, tells me how passionate you are.
Yeah.
And that's who we need to be listening to as a physician.
Yeah.
So it's really important as women. And in your learning, can you tell me one of the most surprising things that you have learned over the past few years in your journey personally, through perimenopause or through your studies of the specialty?
That estrogen is not as bad as everyone says.
Yes.
And I've learned that there is an immense network of fantastic, amazing female and some male physicians out there that are trying to get this out to all of us, to get trained, to be more comfortable prescribing it, to be more comfortable even talking about it.
Yes.
So, and I'm like, wow, this is amazing. This is great.
I love that. She said estrogen is not as bad as it has been made to sound. It's actually our friend. Estrogen is cardioprotective. Estrogen does a lot of things, supports your bone and things like that. Yep. So estrogen is not, I'm going to clip that out. That is so lovely. Estrogen is not as bad as it has been made to sound.
Because I remember that from all our trainings that, oh my God, you're on estrogen, get off because blood clots and whatnot.
Yes.
But we're still digging us out from the Women's Health Initiative.
The dark ages, yes. So yes, and glad we're way past that now, and lots of new studies and lots of new data to be able to see that, no, it's not for everybody, but there are it's a tool that we can use for majority of people now.
And it's like you said, hormone replacement is not for everybody, and it's also not the fountain of youth.
It's
not, and it's not one shoe
fits all. Yes.
It's like we have a toolbox, and we can individualize the treatment for every patient. So
I love that. We are at a point where I love to ask you a supplement that's on your mind. What supplement is on your mind for supplement school with EMLA?
Vitamin D.
Vitamin D. I saw this coming. Because
I remember on this, I said, I don't even know what
so vitamin D.
Is.
So vitamin D is one of those. I'm so passionate about vitamin D. And again, I tell people vitamin D levels, the recommended range is 30 to 100. That's really a big range. Yeah. And I said, in order to, and this is no guideline anywhere, the guideline says 30 to 100 and you're fine. So if you're 31, you're in the green. But in my books, personally, I say 31 is not going to prevent a cardiovascular event. 31 is not going to give us that bone protective ability that we need. Vitamin D, high and adequate levels of vitamin D helps calcium go to the bones and make sure that we strengthen our bones to prevent osteoporosis. And I remind people, 1 in 2 women will have a broken bone from osteoporosis after the age 50.
Yeah.
You go to the hospital, everywhere in the hospital, fall risk in the doors, fall risk. There's a sign everywhere. We're already there just waiting for people to fall, hoping that they don't fall. Could we do this 10, 20, 30 years before?
Yep.
Could we enhance their consumption of calcium-rich foods? Can we enhance their consumption of, there's not a lot of vitamin D-rich foods.
No.
So if you live above the 37th parallel, which is like from San Francisco, if you cut across a line horizontally across the map of the U.S. from San Francisco all the way to like Raleigh, North Carolina, if you're above that line, you live above the 37th parallel. And I always say, even if you get outside and stay naked outside, you're not going to get enough vitamin D. Yeah. And we use sunscreen as well to prevent skin cancer. But then, so we need to absolutely supplement because there's not so much fish and so much milk you can drink and all the fortified foods. Some of them come with added sugar. And we don't want to drive inflammation up by drinking much more milk and things like that. So we need to supplement. It's just the easy way out. And that I've been practicing for 16 years today, and I've not met people with vitamin D levels higher than 100.
Yeah.
So we need to make sure that we're taking a vitamin D3 with K2 and just making sure that this K2 is helping the vitamin D pull calcium to the bones and not calcium to the arteries, the soft tissue, the arteries, and the kidneys where calcium does not belong. Because you go and she will do your calcium score. You're able to order calcium score tests and just to make sure that we don't have calcium deposits in our arteries, because that predisposes us to cardiovascular disease, and we don't want that. So vitamin D is an optimal for hormone health. It's actually a hormone, So it's actually a hormone for hormone health, hormone conversion, immune health, gut health. It's really, it's just embedded in several different reactions in the body. And that's a very easy fix for mood as well. Yes, there have been studies with vitamin D levels. People who have higher levels of vitamin D, they don't have to go higher doses on their antidepressants. Yes, so you could stay on a lower dose. Yes, isn't it great?
Yeah.
Yes, it's just like, it's really beautiful to be able to see something that easy.
And I need to get better to let my patients know about it.
Yes, it's a very easy thing to do, because every time I get a prescription for vitamin D, 50,000 units, that person already had a cardiovascular event. So when they have a cardiovascular event, they're discharged from the hospital, I see them come with Plavix or Eliquis or something like that, then I have a vitamin D 50,000 units. And I'm like, why do we wait until they have a cardiovascular event, then we pay attention to vitamin D? Could we include that as a screening, and start, very basic, And we do a good job. The American Obstetrics Association, they do a good job of recommending it. Every breastfed child has to have vitamin D 400 IU drops. Yes. Yeah. So they do it for the infant.
But not.
Yes. And then when the infants, turn 1, turn 2, and they get milk, the formula has to be, every formula fed child already gets vitamin D, because it has to be fortified with vitamin D.
Yeah.
Yeah. So they get it, when they're toddlers. And then as they're getting older, we just forget.
Yeah.
Teenagers, young adults. No. We'll just wait until they have osteoporosis. And then we'll take care of them at that time. And then when they're diagnosed after the bone density scan at 65.
That's something I don't agree with.
Yes. When do you do a bone density scan for your patients?
Whenever I can. And
I love that answer.
And I do tell them, I've been ordering it, as early as they're in perimenopause, because if we're 65 and we have osteoporosis, okay, well.
Yeah, you waited a lot. You waited too long. Yes.
And they're not expensive. Even if, you can order them, and I think if the insurance doesn't cover it, because they might not cover it, it's like $300.
$300. I love that. You heard Dr. Mara. I asked her, I said, when do you order a bone density scan for your patient? She goes, whenever I want to. I love that. She does what's best for her patients. And this is why I appreciate you, and I appreciate the care that you give to your patients. We will put in the show notes a link to be able to set up an appointment with you.
Perfect, yeah.
And I really want to thank you for coming on the podcast. Yes, today. And people, thank you for listening. Thank you. Please share this podcast with friends, family members, relatives, and so that we get more people thinking about their health in a proactive way and investing in their health, and continue to live each day with intention and gratitude. Thank you.
Thank you.